Hello, I'm going to demonstrate the chest tube placement utilizing the Cook Thal Quick chest tube kit. So for the purpose of this procedure, you want to identify the anatomy and then your equipment. So we're going to do this procedure in the fifth intercostal space at the anterior axillary line. In general, that's at the nipple space, and you just move right around behind the pectoralis major muscle. The other way you can identify this is putting your hand right under their armpit, and it should be right below your hand. So now you've identified the space in which you want to go in. This procedure is intended for pneumothoraces as well as large pleural effusions. And we already have the fluid in here. As far as the kits, this is a sterile procedure. I'm using regular gloves for the purposes of this demonstration. Please know that there are many ways to do a chest tube. Classically, it's a very large French chest tube, and this is only a 12 French chest tube, which can still be very effective in removing fluid. So you've identified your anatomy. You're going to want to, well, let's look at our equipment. So we have our sterile drape. We have the actual chest tube right here. We have 3 dilators. You can sequentially dilate. For the purpose of this procedure, we're just going to use the largest 13 gauge one. There's the actual chest tube needle. That's just 14 gauge. We have lidocaine, and you can place a local anesthetic for the procedure, and then suture, and right here is the guide wire, okay? All right, so for the purpose of this procedure, you can have them placed at 45-degree angle. Some people have them lying down, and just since this is standing up, we're going to do it that way. All right, so we're going to want to clean the identified space with the chloroseptic. Okay, so circular motions. We're going to use our imagination and place the sterile drape over this. I will be wearing sterile gloves as well. And then what we'll do first is we'll want to place the actual needle into that fifth intercostal space. So I have it palpated. You want to go directly above that rib so you don't hit any neurovascular bundles. So place that up a little bit, and you will see some fluid coming out. Next, you'll want to place the guide wire into the location. So you want to move it so there's a little piece of the guide wire out, and it has a curled tip which will not go in. So now, holding this, you'll want to place the guide wire into that needle site. If you do get a little bit of resistance, that's not abnormal. Try twisting when you push it in, okay? So you still have about 12 inches of guide wire left, and then you'll want to remove both the 14 gauge needle and the introducer tip. Okay, and place your sharps there. You can use the smallest dilator first and then move up to your 13 gauge, but for the purpose of this procedure, I'm just going to use the 13 gauge. Before this, and I don't want you doing this on the actual model, you can nick the skin, and you want to place a little cut right there, and this will help the dilator go in. So you take the dilator, place that in the guide wire, and place it all the way in to the track, okay? This will create a nice track for the chest tube to easily go in. Remove it, make sure you do not lose that guide wire, and place that out right there. Subsequently, you're going to want to put the chest tube in, which you can see right here, place it onto the guide wire, like so, and make sure that part of the guide wire is coming out the back end of it. Perfect. Hold the guide wire so it doesn't go in, and you could pinch the guide wire with the chest tube, and you want it to go in all the way. Okay? It has a curled tip, so it should not damage anything. You'll want to remove the guide wire. Okay? At this point, you can set it up to the actual chest tube. We do not have a pneumovac, which is typically used. This is just a regular suction. You can use a Heimlich valve or just regular suction, and I'm going to demonstrate that this is in the proper placement. So I'm going to put this up right here, you can see it dripping. I'm going to turn on the suction. And you can see fluid running out of this. So we know it's in place. At this point, we want to, you can tape it in place, but suture will be even better. And you'll suture around here, and then purse string suture will be fine. Tape it up. And then typically you want to get a chest x-ray to confirm placement, make sure it didn't go anywhere that you didn't want it to. Thank you very much.